Start my newborn assessment. I would start by walking in the room, introducing myself, checking the baby's ID band, performing hand hygiene, and putting on gloves. I would then start with vital signs, temperature, respiration, pulse. Normal temperature is 97.5 to 99.6. Respirations are 30 to 60, and heart rate is 100 to 160. I would also listen to lung sounds bilaterally, and I would listen to their heart at the apical pulse for a minute. Make sure there's no murmurs. I would start then with his head. I would check his fontanelles, make sure they're good. I would check suture lines, see if there's any bruises or scrapes on his head from birth. I would move to the eyes. I would check if they're symmetrical, if there's any drainage. I would check the folds and make sure that's all good. I would then do the nose and check patency of the nostrils. You could do that by like plugging one nostril and seeing if the baby can breathe. If not, you could suction with a bulb syringe. I would then move to the mouth. I would stick my pinky in his mouth and check his palate, make sure that's intact, and I would check for suck reflex while doing so. I could check his ears, make sure they're symmetrical, and I would check the recoil by pulling down the pinna and seeing if it recoils back. I could then move to the neck, and I would just feel from the back of the head to the front, make sure there's no lumps. I would check, range of motion. I would move his head from one side to the next, make sure he's got motion in his neck. And then I would check his clavicles, palpate them, make sure there's no fractures. Those can be common after labor. I'd move down to his abdomen, check, palpate it, check bowel sounds, make sure it's symmetrical. Then I could check respiratory distress at this time, see if there's any signs of respiratory distress like retraction, seesaw breathing, cyanosis, things like that. I could check skin next, make sure his color's good, see if he has any vernix or anything on his skin, any lacerations, bruising. I could check for jaundice at this time. I could check his forehead, his arms, his legs, his eyeballs, his whites of his eyes. I forget what that's called right now. And I could check the umbilical cord, make sure that everything is well, there's no discharge. Then I could check his spine. Check his spine, make sure it's midline, make sure there's no dimples at the base of it. And then I could check his grasps, his plantar and his palmar grasps, see if he grasps my finger when I put it there. I could check genitals, make sure that if he's male, I could check if he's circumcised, if there's any discharge, if his testes are descended. I could check the rugae on the scrotum. If she's female, I could check her labia, make sure they're covering the clitoris, make sure, if there's any discharge. I could check his muscle tone, move his arms, see if they recoil back. I could assess if he's crying, if he's calm, his behavior. And I could do the Mora reflex by tapping the bed or clapping my hands and seeing if it startles the baby. then, what did I forget? Oh, when you're assessing their head, you want to check if they have any signs of cephalhematoma, which is not good. That means bleeding's occurring. Or if they have a caput, that could be normal after delivery because of the baby going through the canal. I could check when the baby last voided or had a BM. I could ask mom if she knows. I could see if he's eating well, if he's breastfeeding well, how that's going. I forgot Babinski too and the reflexes, but I think that's it.